How's everyone doing? Can you hear me? Yeah? Okay, there we go. So I know it's 3:50 in the afternoon, and everyone has been here all day, so appreciate everyone through this. I'm going to try and get a little bit of audience participation. Right up. Better? Okay. My name is Dr. Sean O'Grady. I'm on the product team at Elation. It's my second year at the Hint Summit. I got a couple thank yous to throw out. One, to the Hint team. You do such a great job of putting this together. I know how much work it is. I've seen all of you running around for the last few days, weeks, whatever it's been. So thank you so much for being such gracious hosts, for putting this on, for getting everyone in the same room, and for making us a part of it. More specifically, we have a couple of thank yous to throw out to the Hint product and development team. As some of you have heard, we've spent a lot of time and effort to upgrade the integration between Hint and Elation this year. There's been a lot of work put in. Greg Hilkert is running around here somewhere. Greg had a huge hand in that, so we want to say thanks to him for all his work. And on the Elation side, a couple of developers who spent many nights and weekends making sure everything worked. Darren and Arjun, who I'm not sure if Darren is still here or not, but a lot of work went into this. We're really excited about it. If you haven't seen it yet, you can go check it out with Gabby and Crystal up front. So let's switch gears here. I want to talk a little bit about data. So what I did last year was I talked a little bit about how DPC is trying to scale. Really, we were looking at growth and the ability for a DPC provider to see more people and not compromise on the quality of care or the quality of lifestyle or the patient experience. This year is going to be a little bit different. So this year we are going to look at the data that lives in Elation at the point of care. So I'm a clinician by trade. I was a DPC provider for a while before I got into software. And if I were one of you, I would want to know, I would basically ask the question, what can Elation tell me about the things that are going on in its platform that would ensure that if I was in charge of taking care of patients in my practice or in my community, that I would always be the smartest person in the room. So Elation has the privilege of being in the visit with many of you. So we thought we'd take a look and see what's going on under the hood. So we started with the atomic unit of healthcare, which is the appointment. We had about 4 million of those last year on the platform, which is nothing to sneeze at. So there's a whole bunch of stuff you can do when you look at an appointment. And for a product manager, that's kind of can become a can of worms. You get to look at the database and see every kind of little piece of data that gets generated in an appointment. So to put some constraints around that, we thought we would look more specifically at what's common. So we wanted to see what was common across the US with Elation providers who were documenting things in visits, telling us what's going on, and see if we saw anything interesting. So we're going to do a little bit of top 5 trivia. So again, it's late in the day. I want to get some audience participation here. You will be judged on this. So top 5s. We looked at our database and we wanted to see what were the problems that were coming in that our providers were discovering in their patient populations. So first, patient problems, top 5. Any guesses? Any takers? Hypertension, yep, keep going. Back pain was on there. I heard something else. Diabetes. Pretty good. I think we're probably 4 out of 5 right now. Let me show you. Okay, hypertension. Top of the list. Next one. No abnormal findings, which was interesting. Third, hyperlipidemia. So for those who are not clinicians, we're talking about like cholesterol and things like that. I have a 5-year-old girl who's watching this at home right now who needs to understand these things. Type 2 diabetes. And then the 5th one I did not expect, which is screening for another disorder. So those are the top 5 most common patient problems that are turning up in Elation in 2018. Next, lab orders. Any guesses? Most common lab orders on elation in 2018. This one's probably going to line up pretty closely. Yep. Okay, so A1C, CMP, so that's comprehensive metabolic panel. TSH, talking about thyroid. NF is non-fasting lipids. And then CBC, right? So pretty straightforward there. No big surprises. Last one, prescriptions. I heard metformin. I heard, yeah, lisinopril. Lots of good guesses. Okay, look, here we go. This one kind of threw me off a little bit. First four are fairly predictable. You've got your blood pressure medications, you've got your cholesterol medications, your antibiotics. Fifth one was hilarious to me. I had no idea that this was going to happen, but it was shingles. It's a shingles vaccine. That was in the top 5. Okay, so cool, you get the point. We can look at our database and pull some interesting charts out of this. It's cool for decks and like presenting to people who don't provide healthcare. I provided healthcare for a long time. This isn't actually all that useful to me. I want to see this, give it some context and give it a place. So we took all this information about 48 hours ago, and I pulled a couple of my developers out of their current work for some nighttime work with me, which they were very nice to oblige. And we love maps, so we thought maybe we would try and essentially make this useful in some way. Now, we did it just for ourselves and decided to look at specifically at the patient problems, but we saw some really cool stuff, and I'll share this with you afterwards. I'll get some help from Louise at the end as well, but this is let me just explain this. So this is most common patient problems in San Francisco, and what you're looking at here is zip codes. So we wanted to try and obscure as much as we could. So these are zip codes in San Francisco. Anything that has a color is one of the most common patient problems across the US. Okay, so you can see up near North Beach, we've got essential hypertension, so high blood pressure. You can see areas where we've got hyperlipidemia and cholesterol problems. You can kind of see, if you look across here, we hit 4 out of the 5. The only one that's not on here, interestingly, is diabetes. So type 2 diabetes on elation, on the elation platform, was not one of the most common patient problems in any zip code in San Francisco. It's kind of interesting. But if you look at the gray dots, the gray circles, you see some other interesting things. So one, over by Glen Park, which is towards the bottom, you see allergies and Lyme disease as the 2 most common diagnoses, which is interesting. The other one that you'll see kind of dead center, right in the middle, and I know this will probably not be a surprise to Dave Chase, wherever he is, but dead in the center is opioid dependence. And so we're starting to see some interesting things. We're not trying to do, I don't know what you want to do with this, but for me, I thought of ways I might want to use this information to get in front of my patient problems or to be able to reach out to communities in the area. So this is something you can, if you want to learn more, if you want us to try something out for you, let us know. We can do that for you, and I'll send this around. You can click on the link and actually see this wherever your practice happens to be. Thanks very much.